Good afternoon. Welcome to Marketplace 5. I'm Jessica Taloni. We all want to look younger, and one of the quickest, easiest ways to do that is with injectables. They can soften facial creases and wrinkles and restore fullness to the face, kind of like a liquid facelift. I'm joined today by Dr. Henry Barber of the Martin Center to talk about injectables. And let's start with what I would say is probably the granddaddy of injectables, Botox.
Sure, and Botox is the product that has the most name recognition on the market as far as injectables go. Almost everybody's heard of it. It works very well to treat the frown lines in between the brows. It treats the horizontal lines across the forehead as well as the crow's feet around the eyes. It typically lasts about 3 to 4 months, and it works by relaxing those lines away.
And certainly Botox isn't the only product out there. There's Juvederm. Tell me what that is and how long it lasts.
Right, so Juvederm works differently from Botox. It's a filler, so it's a clear gel material that's very soft. We place it underneath the skin in those lines and wrinkles. We can use it to improve the lines around the mouth, in the cheeks. We can use it to add volume into the lips to give you a very nice, natural increase in lip volume. It does not have to look like a trout pout. It can look very natural, and it typically lasts about 6 to 12 months.
And so 6 to 12 months, that's about a year. What's out there if somebody wants a product that's going to last longer?
Sure, well, we do have a filler called Artifil that's available. It is by far the longest lasting filler on the market. It typically lasts 10 years or longer. It's considered a semi-permanent filler. We can use it in many of the same areas that we use Juvederm or other fillers, but it gives you a much longer lasting result than what you get with other fillers.
10 years, that's a long time.
Sure.
So talk about the cheeks for a minute, because as we age, we often see the cheeks deflate and maybe droop a little bit. There's a product called Voluma that you guys can tell us about.
That's right. So we found that as people age, you lose volume in the face. Overall facial volume goes down, and as that happens, you do deflate in the cheeks and the temples, and you see those tissues start to fall down and in. If we can replace that volume with a product like Voluma, which goes right into the cheeks and helps to lift those cheeks back up, it significantly improves the youthful appearance of the face, and we can use that in the cheeks, the temples, and other areas.
And certainly it's important to find a doctor that uses these injectables on a daily basis. At the Martin Center, you guys not only work with patients on a daily basis, but they're a training center, so you work with other doctors teaching them how to do some of these procedures.
That's right.
So if you want to get a hold of Dr. Barber or anybody at the Martin Center, you can call them 251-344-7474 or visit their website, themartincenter.com. With Marketplace 5, I'm Jessica Taloni.